My mom was 96 when she came to live with me, and she stayed in the house here for about a year, and she was getting hard to handle because she was starting to get dementia at the time. So we decided that it was time that she should be in a place where it was one level. So we put her into Sydenham residence. She stayed there for about a year and a half until she started walking out. She'd grab her purse and figured she could go home. Being the youngest of the family, it was hard on me because I always thought it should have been the oldest doing it, but he was in Kingston. So it was left onto me, and Mom had me when she was 42. So I was her baby, and it hurt her that I would think of putting her somewhere. It was easy for us to put her into Sydenham residence because it was like an apartment. So that was easy, but when it was time to put her into long-term care, social worker come in and talked to us and told us that, you know, her stages were getting too beyond that the residents couldn't care for them. And so they told us that she had to go into a nursing home and into lockdown. And they came and they evaluated her to make sure that it was right for her. She was in the nursing home and she fell. And they had to transport her to the hospital because she broke her pelvis. So she was there for a while and she never wanted to go back to the nursing home. When Mom was in the hospital, she says, "Oh good, I'm in the hospital, I don't have to go back to that place." And I says, "Mom," I said, "you're only here for a short time." "Why? I can stay here. Same thing as over there." And I said, "No, Mom," I said, "you have to go back to the other room." I said, "These beds," I said, "are people who are sick." I said, "You're not sick." She says, "Well, I'm hurt." I said, "But they can take care of you at the home being hurt." I said, "It's the same thing there." I said, "People here," I said, "right now," I said, "sick people, if you're in this bed, someone who's sick can't have this bed." So we convinced her that that was the best place for her to go. So then she went back to the nursing home, and that's where she passed away. It was in the nursing home. I'm a patient experience partner, and that was a role I took because I got cancer and I wanted to give back. And you know, when I think about people in long-term care and in the hospital, I often think, you know, there's people who stay in the hospital because they don't want to go to a residence or a nursing home, and they feel that they're quite content in the hospital. But they are missing out on a lot of things. Staying in a hospital, you don't get the people around you talking with you. Nurses come and go and they talk to you, but you don't get the camaraderie with people. In a residence, you play cards, you play games, you play bingo. People come and sing, and they don't do that in hospitals. And I think at that stage of life, I think as a human being, you deserve that. I mean, you've had people around you all your life. They don't have much longer to live, and they might just as well enjoy it instead of stuck in bed. And then there's the person that needs that bed, and really, long-term care people don't need that bed. They need people around them, laughing with them and talking with them, and let the bed for sick people.
I get calls often from family members who say, I can't do this anymore. I really just can't do this one more time. And when I think about what it's like from the patient's perspective, I hope they find the resources to do it just once more so that that person can go home. That even in dementia, even in delirium, people often do better when they're surrounded by familiar sights. I think really the best thing to do is to go home if you possibly can. My advice for families is learn what you can about the process. I think it's a bit of a mystery, and I would really like us to share with our communities, how does the system work? And I've heard it said that someone's family member had a plan for their funeral, and it was paid for and ready, and they had somebody who was cutting the grass, but they had no plan in between. I would want them to have conversations. Have conversations before you need to make a decision. The other thing I would say to them is this is hard emotional work, and that when you have to make a decision on behalf of somebody that you love, it may be one of the hardest things that you've ever done. And I hope that as healthcare providers, we recognize that and that we support you really well in it. But learn as much as you can about the process. So I think as healthcare providers, we can begin there. What would it be like for us today to not go home? To have something happen, a fall, a fracture, a stroke, something that made a chronic disease worse, where someone said to us, you really can't go home. You really shouldn't go home. You won't be safe at home. What would it be like? We can begin there.